profession. It's who me. You know what I mean? Like there's such an important trust, and to feel that I violated that with someone, that the sexual stuff for It's
guys, you have hindsight, and that's why you're saying this cop's an idiot, not recognizing that this dude is smooth as fuck, okay? Like, he is a fucking psychopath. And, like, very clearly, one, she didn't know. Like, she literally didn't know that there were other victims. And two, like, she thought that there was only this young girl, her testimony, and, like, his very convincing expertise that she has no way of undermining the credibility of. What she should have done. No, this is... She only knows one instance. She's looking into one instance. Okay? Simply with the cop law, she probably should have consulted experts. But, you know, it's like... It is a little bit of hindsight there.
Us. That's the hard part for me. Okay? Because that's the whole thing. Sorry.
No, you're okay.
To break someone's trust. That irritates me. Okay? Sorry.
No, you're fine.
What I always tell people, you can't get that back.
No, you're perfectly fine. I'm sure if I put myself in your shoes, I mean, it's weighing pretty heavy on you all the way around for a multitude of reasons.
Right.
So there's a couple things that I want to do here. Obviously, I want to get the videos because it does illustrate what she and you are both saying happened, right?
Okay.
There are only a few minor places where you guys kind of split the road there. Everything you're telling me is everything she told me. So it's not like she's telling me anything else, okay? So what you're saying that you would have done is what she's saying you did.
Okay.
Detective O'Brien's continued reassurances that Tomasho and Nessa's accounts match almost exactly perfectly encapsulate her bias in Nessa's favour. The fact of the matter is that Tomasho was not at all vague about the specific manner in which Nessa assaulted her. She reported that Nessa had placed 3 fingers on top of her vagina and rubbed in a circular motion. Nessa has acknowledged performing internal work, but he has never described precisely what Tomasho alleged, and O'Brien has never put those specific descriptions to him.
Okay, never mind. This cop's dog shit.
To see if he reacts with evasion, justification, or outright denial.
Again, what we're looking...
Okay, she's dog shit. I take it back. I was wrong. I was right about the top of the hour ad break that's coming right now, because it is top of the hour, and there is a 1-minute ad break here. I was right about that. And I'm also right that if you want to avoid those ads, like I would tell you, you can use a VPN or an ad blocker, or you can subscribe. Now, you can subscribe for $5, or you can subscribe for free with a Twitch Prime. Those are... You're skating on thin ice, buddy. Yeah, what's up, dude? Yeah, no, that was pretty good. You know it. I know it. We all know it. Doesn't fucking matter. Okay? It's fine. I got you pretty good. It's all good. Here's the 1-minute ad break now. As I was saying, dude, I gotta stop fucking putting the segue into, like, a legitimate point that I'm making, because I forget the point I was making half the time. Thank you, Kelso, for the 25 get the subs. That's called the dog shit technique? Yeah, I hope you run out of tomatoes. Yeah, no, she's not good. Cop is dog shit. Yeah, she's not good. She fucking should have brought up what the victim's testimony was to see how he reacts to it. That's not even hindsight 2020. That's like, if you suspect this person.
Looking at is maybe perceptions,
misperceptions,
that she felt that she didn't know what was coming or what was going to be done for explanation purposes. And again, this is what she's saying.
I totally understand.
But what she's saying happened is exactly what you're saying happened.
Yeah, because I talk to my patients all the time. That's why I make that. You can see the videos. I have a whole website of education. I mean, it's gymnastics doctor Facebook, gymnastics doctor YouTube,
Bro, she literally should have been like, do the same thing that you did to her to me. Do it to me, pussy. I want to know. And then she should have compared it and been like, that's not what she said.
Gymnasticsdoctor.com. It's all about education. It's all my company's gymnastics doctor, the sports medicine professor. You know what I mean? It's like, that's what I'm known for.
Nasser continues to repeat his line of defense that he always checks in with his patients while he's working on them, and bemoan the loss of trust that he holds so dear. He also resolves to make changes to his practice to ensure such a terrible misunderstanding will never happen again, such as always having a third party in the room during treatments.
The difficult part of weeding through this, obviously, is right now it's titled as a sexual assault report.
Yeah, that hurts, but yeah.
Because that's what she's reporting, right? So right now, obviously, technically, you're the suspect in that sexual assault report. It's under investigation, though.
Okay.
So we want to find out what did happen. That's the whole purpose of a police investigation. It's not to jump to conclusions, it's not to take sides, it's to find out what specifically happened.
Right.
So in seeing what you showed me here today and what you're going to send me, the one option that may be available to us, and I need to talk to her first, is a polygraph examination.
Sure.
And a lot of people have a misnomer that they think that's a lie detector test, and it's not.
Bro, how do you go to the fucking polygraph before you literally bring up fucking bring up the testimony of the witness and compare it to what his statements are?
It shows both. It shows whether you're being honest, and it shows whether you're being dishonest.
Okay.
It appears to me that you're telling me the truth sitting across me, unless you're a great bullshitter, and you pulled the curtains over my eyes this whole time. But in combination with what I'm seeing here today,
that'd be...
I feel like you're telling me the truth. I mean, you're coming in here voluntarily. You're wanting to clear.
That'd be crazy if he was doing that.
Your name, and that's what a polygraph can be used for. Also, is to clear your name.
Whatever is needed.
So it's not the TV show calls it I hate TV shows. You probably hate medical TV shows, right? Just like I hate.
Oh my god, bro! She's literally like, "Yo, we're fucking best friends now." Yo, this cop probably fucking hates herself now. No shot. She does not look back at this interrogation that is like widely available for people to see and goes, "Oh my fucking god, I absolutely did a horrible job here."
Law enforcement TV shows. 3/4 of the stuff isn't true. So it can clear people also.
Right.
So if you're sitting here and you're being truthful with me today, and everything you've said is the truth today, in combination with these videos, what that would show is that you did it for medical purposes, not for any other purposes, right?
Exactly.
I've been investigating sexual assaults for the last 8 years. I have not run a polygraph like this, where it would be medical versus, say, a sexual assault.
Okay.
I would need to consult with her first to make sure that that's something we can do.
When Detective O'Brien did consult with a polygraph technician, they actually quashed the idea of Nasser taking the test, saying that it would not be effective in this case. A possible reason for that is that Nasser wasn't disputing putting his hands inside Tomasho, but rather the intent behind doing so. The latter of...
Bro, that's fucking crazy. That's like I can't believe he admitted to putting his fucking hands inside of this girl. And these guys are stupid enough to fucking think that this is like a medical procedure, dude. Like, how is that physical therapy, dude? Like, he literally admitted to digital penetration, okay? It's nuts. Wait, no shot. Are you serious? Former MSUPD captain charged with carrying a gun, driving while intoxicated? Oh my god, dude. God damn, this person is like, holy fuck.
Of which may have been too abstract a contention to put to a polygraph.
I also don't like to have these take a long period of time. So, it'd be my goal that hopefully that it would just be maybe a few weeks.
Okay.
Gynecologists literally finger you in exams? Yeah, motherfucker, but he's not a gynecologist. Okay, what's your point? And a gynecologist can still, rape you, okay? The difference between, an actual exam and someone fucking raping you is consent. That's the key there. Also, gynecologists are not using bare fucking hands, dude. Don't they have those cold fucking, scissor looking things that open up and shit? Or at least they use gloves and shit?
And then we could have the investigation completed.
Okay.
Obviously, that would be dependent to, okay, can we do the polygraph? When can we get the polygraph scheduled?
Right.
So for your 5.5 weeks, is that kind of, how was that time frame put in place? Or how did they come up with 5.5 weeks?
That was just the dean just said.
Okay, just
Go to
said, hey,
June 30th,
okay,
you
so
know.
that ended June.
And I've got a
It is pelvic floor physical therapy. Certain muscles can only be reached internally, but you would always get informed consent, which includes explaining the procedure, and she likely was not a candidate based off of her complaints. Oh my God, that's a real thing? What the fuck?
week vacation that's in there. So
I actually leave for vacation myself that week.
Okay.
So what my goal would be,
That's right.
bar
Right.
any unforeseen
Right.
circumstances,
Right.
is that we have this wrapped up before you and I go on vacation.
That sounds
Okay, so like I said, bar any unforeseen circumstances, I don't want to leave and go on vacation myself
Right.
and still have
Right.
some things to tidy up here.
Right.
So I guess if that helps, that would be my time frame.
That's good.
If you've been paying attention to the time code in the bottom left corner, you might have noticed that the forwarding has been particularly aggressive for this interview. That's not just for the sake of time. There are really only a handful of components that make up Nessa and O'Brien's nearly 2.5 hour exchange. There's been a complaint, Nessa contends nothing he performs on patients is sexual in nature, and offers technical explanations. Detective O'Brien acknowledges these things can boil down to simple misunderstandings, and that Nessa's explanations seem to add up, but she still needs to investigate. Nessa is upset with the situation, and acknowledges he needs to implement changes in protocol to prevent such misunderstandings from happening again in the future. And Detective O'Brien thinks a polygraph could be a good idea, but needs to consult with a technician. In other words, everything you've already seen. All that takes place in the 2+ hours that have been cut is more or less a repeating of those components again and again and again. The
Pelvic floor treatment is for incontinent old women, not children. That's literally untrue. You're literally incorrect. I am currently reading an article on the other side on my second screen about how pelvic floor therapy can be for young girls as well. It's just that not these young girls. So you are incorrect. It can be for women of all ages, including young girls. I think specifically after they get their period or something. But regardless, it doesn't fucking matter because these people did not need it. So
overall investigation was conducted in a similarly shallow manner, so it should come as no surprise that Larry Nassar avoided his comeuppance yet again.
yeah, you can't do a fucking... You can't go to this doctor with like a fucking hamstring injury and he's like, oh yeah, I'm gonna shove my fingers in your pussy. Like, that's fucking insane. Sorry for using such graphic language. Like, okay, you don't do that. Especially not
When
a
seeking to
6-year-old
verify
with
the
no
validity
gloves.
of Nassar's procedures, investigators consulted only with physicians that were his colleagues. And even worse, the practices that they posited to these experts were Nassar's descriptions of what he was doing, not Tomasho's. 3 months after Detective O'Brien's interview, investigators released a Title IX report that found Nassar's practices were, quote, medically appropriate, but stated that Tomasho's complaint was still, quote, helpful in that it allowed them to examine certain practices at the MSU Sports Medicine Clinic. Larry Nassar was allowed to return to work under the proviso that he make certain changes, such as always having a chaperone in attendance during treatments, wearing gloves, and obtaining informed consent from his patients. It has been estimated that he went on to victimize 70 women in the 2 years that followed. The investigation did
Jesus
not interfere
Christ,
with anyone's
dude.
vacation plans. Fortunately, Nassar
he fucking brutalized her.
wasn't able to escape justice forever, but before unpacking his long overdue ruination, we need to go back in the case timeline to the year 2000.
What are you gonna do, bro? She had fucking, she had to go on vacation.
In 2000, Larry Nassar victimized the girl who would ultimately grow up to be the beginning of his end. Her name is Rachel Den Hollander, and her story is astounding. Nassar assaulted Den Hollander when she was 15 years old during treatment for back pain. Den Hollander knew at the time what had happened to her was wrong, but grappled with what she should do. The calculations that she made at such a young age were depressing in how accurate they were, but at the same time incredibly
What the fuck is that B-roll footage, dude? I'm sorry. The calculations she made at that time, and then they just put a complicated math equation. Like,
astute and prophetic. Den Hollander reasoned that because what Nassar had done to her was under the guise of medical treatment that he was a world-renowned expert in, it would be exceedingly difficult to
Sorry.
convince authorities that she was sexually assaulted based only on her word alone. She decided that the pain of going through the process of making the allegation would not be worth it unless Nasser was actually brought to justice, and because she saw the probability of that to be negligible, she opted not to make any report. But this is not to say that she gave up on the prospect altogether. She did not resolve to simply accept that she was victimized and move on with her life. Instead, Rachel Den Hollander began building a case. She obtained the medical records from her treatment, noting they made no mention of penetration. She kept a journal, which in addition to notes from her therapist,
Holy
created a
fuck.
contemporaneous record of her feelings during the time following her abuse. She even consulted with medical experts, compiling a multitude of opinions on proper practice.
Bro, this fucking girl literally did more investigative work as a victim than a professional cop, like, whose sole job in the aftermath of a credible accusation was to do proper conduct in an investigation. What the fuck, dude?
Practice in relation to pelvic floor therapy and what types of conditions would warrant such techniques being utilized. After all of that, Rachel Den Hollander had only one thing left to do: bide her time.
Dude, how the fuck do you... Okay, the thing is, what you have to understand here is that, like, she's also literally going through this and recognizing that, how do I describe it? Like, she's literally, the more she investigates this own thing, the more she's gonna be recognizing that she, like, got sexually assaulted. So that can't be fucking, that's not like a normal investigation. You're like also simultaneously unpacking fucking trauma, or basically like bringing on additional trauma to yourself, which most people will usually shield themselves from that and like completely shut it off or try to normalize it and try to justify it. So like it's doubly fucking wild that she was able to do this. So just remember that.
Because while she believed an impressive DIY case file was key to her getting justice, there was another essential piece of the puzzle which she would not be able to create herself: momentum. It was Rachel Den Hollander's belief that because NASA was not only well established as an individual, but also backed by vast amounts of institutional power, that one woman alone, even one with supporting evidence, would still not be enough to guarantee his downfall. But if her accusation were to come in conjunction with at least one other, then the situation would be
Actually,
serious enough to
that
warrant
shit.
serious investigation, especially if the independent accounts attracted some media scrutiny that would make things much more difficult to sweep under the rug. This may seem like a strikingly specific series of events to count on, but Rachel Den Hollander was not a psychic. She was just a very adept, logical thinker. She knew sexual assault was not the kind of thing a perpetrator tries once and quits. If Larry Nasser had done what he did to her, he must have done it to others.
Yo, that's
no matter
fucking
how well
sick.
he had set things up to disincentivize victims from coming forward. A public accusation was bound to surface eventually. It was just a matter of time. And in August of 2016, the now 30-year-old attorney Rachel Den Hollander saw an article from the Indianapolis Star while browsing her Facebook and realized that that time had finally come. It wasn't precisely what she had been waiting for. In fact, the article made no mention of Larry Nasser. It was a report on how USA Gymnastics, the governing body for gymnastics in the United States, had failed to report multiple accusations of sex abuse against coaches. Nasser worked for USA Gymnastics, not as a coach, but as a doctor, and if the organization was now being publicly scrutinized for covering up sex abuse within their ranks, it was all but inevitable that his name would be coming on the newspaper's radar sooner or later. If she came forward now, finally, she could be confident that she would not be alone, at least not for long. And so Rachel Den Hollander wrote an email to the paper stating that she was willing to share her story and her documentation, and also publicly disclose her identity. Not long after that, just as she had counted on, the paper received another tip naming Larry Nasser as an abuser. Then a third from former Olympian Jamie Dancher, stating that she planned on filing a lawsuit against him. Indie Star journalist Mark Alicia worked with Den Hollander on a report about the Nasser allegations. Once his report was finished, and Den Hollander knew that a story about 3 independent accusers was on its way to the printing press, she now had the insurance that she had needed for so long that an official complaint could not be brushed aside, and so she contacted Michigan
Dude,
State.
I didn't know the details of this. I've never seen the documentary. I just like remember this case. Like I remember looking into it. I didn't know the intricate details of this, but like I did not think it was going to turn into a positive story because it's so fucking dark overall. Like, that's nuts.
State University Police to make a report. Her call was taken by Detective Andrea Muntford. As it turned out, Detective Muntford would not need a pending bombshell report to take Den Hollander's accusations seriously, as she was aware of the department's investigation of Nessa over similar accusations 2 years prior. And so Detective Muntford asks Larry Nessa in for an interview, and just like in 2014, he readily agrees to make himself available. The similarities to the
Why is the chat
2014
infantilizing this
investigation
woman?
will
They're
mostly
not.
end there,
Who
because
the fuck
now
is
so
infantilizing
much has
her?
changed. Now, the existence of sex abuse within USA Gymnastics is becoming a matter of public record. Now, 2 separate women have made similar reports to the police about Larry Nassa, in addition to another 2 about to come out in the press. Now, the detective Larry Nassa is sitting across from is not particularly inclined to believe his side of the story. Now, Larry
Let's go get
Nassa
fucked.
is in
I
a
wanna
lot
see-
of trouble.
I want to see him be fucking brutalized here, dude. I really want to see him get, like, absolutely cumstered here.
Thanks for coming in so quick, too. Obviously, you're not under arrest, so you can leave whenever you want. Anytime we bring someone to interview room, we make sure that they know that. I know you talked to Val O'Brien, one of my colleagues,
Yeah,
a couple
wow,
years ago.
right,
Yeah.
right. Okay.
What I want to talk to you is kind of go back to that situation. And I know that you guys had, sorry, papers on there, talked about maybe redoing some practices and things in relation to that. Reference that situation. What do you recall about that investigation?
Right, that had, concerns over the form of treatment that I was doing, and that I talked about having to do the reasons why I did it, from a manual medicine standpoint. And there was a student that was in the room that had to leave to start because I was behind. We need to start another patient, and so we're like, always have another person in the room.
Right.
You know what I mean? And I've been trying to adapt my techniques so we won't get into the same situation.
Okay.
Nassa states that after the 2014 complaint, he implemented changes to prevent any future misunderstandings. The fact of the matter is, he changed little if anything. He didn't so much as begin reliably wearing gloves. Detective Muntford will now do something that is simple, effective, and was lacking in Detective O'Brien's interview 2 years prior. She will promptly ask an obvious follow-up question.
What practices have you changed in response to
I've been trying to have people in the room,
Okay.
Trying to have people in the room?
And
That's a vibe check, boys. It's over. I'm just saying, I mean, the vibes were fucked already the moment he said, like, here's my PowerPoint presentation. But, that's
trying obviously not to get into that same situation. Do you know what I mean? Like, has there been another complaint? I'm just confused right now.
Well, we're kind of seeing what things have changed, what practices.
Okay, yeah. So I'm trying to do things where the difficulty is with the hands-on is I'm trying very hard to do things where I'm not being nearly as invasive, but it compromises things. So I am trying to modify that and having students there and having family members there, and I document in the chart, so-and-so's in the room.
The presence of family members did not impede Nassa from violating his patients. It is true that in many instances, the parent of a victim would be in the room at the same time Nassa penetrated their child with his hand.
what the fuck is that, dude? Are you fucking kidding me? How the fuck? What kind of sick fuck? Like, what he's doing is sick to begin with, but what the fuck in front of parents? Like, throw the parents away? I mean, I don't understand. Like, what is he getting out of this? Like,
The strategies he employed to evade their suspicion were rudimentary. He draped a towel over his victim so parents could not see exactly where his hands were going, and sometimes positioned his body to block their line of sight.
So my documentation's changed. I'm trying my best to do it over close, and that's sometimes the hard thing is the tightness. It's like the close gets in the way.
Yeah. Can you explain the technique? I've never been to these,
So,
but
and essentially,
I mean, throw the dude in a... Someone in the chat said, throw this dude in a volcano. I am inclined to agree. I mean, this is like... You lock this dude up. I don't know what you do. I don't know if you can... I don't know if you can rehabilitate this person, okay?
videos.
I mean, obviously, no capital punishment. It's you know, but goddamn, dude.
Too. I mean, like,
Yeah.
I lecture on this. That's the thing that's frustrating. It's so, you know, the sacrotuberous ligaments. It runs from the pubic symphysis, the falciform process. It runs. It's like the pelvic floor. Okay, you want to understand the stuff. So you're really coming in. Like the way to describe it, you know, even in some of the videos is it's like you go towards the labia and go lateral. So you're going in and apart. Okay, and then there's muscles that attach to the ligament, and so as you're treating that, you can feel the release.
I mean, I don't think that no one deserves the death penalty. It's like
feel the rib cage, okay, and then I go and I release that, and they're like, "Oh my God, what did you just do?" You know what I mean? Because they can feel that effect, you know, from the way that the muscle, the costalis thoracis runs down from the rib cage into and entwined in the sacrotuberous ligament.
Now, how long have you been doing this technique?
I have video from 30 pounds ago, from like the 1990s. I'm trying to remember. It would have been in the 1990s. You know what I mean? Like early 1990s.
Right.
You know, and I've
the
made
person who said he's dead. He's not dead. He's not dead at all. I don't know why you said that.
video is very clear. You know what I mean? And I've lectured. Oh yeah, you know, and I've lectured. And
Are those online anywhere?
they're on my G drive, like I said. That
So how would a patient be laying to get that treatment?
prone, and then they're lay prone, you know, and then you're doing that, and then I can do it seated. I talk about doing seated. I can do it standing. I can do it supine. So yeah, you can do, but
Would they be
Why are men allowed in gynecology? Are you fucking stupid, dude? Are you a stupid person? Like, they're fucking doctors, idiot. What kind of dumb take is that? Doesn't even have anything to do with like. Yeah, what if he's gay? Like what if the guy is gay? I mean, I don't even care. Across the board, like it doesn't fucking matter. Or what if the female doctor's a lesbian? Can they not be a gynecologist then? It's just like, what a stupid fucking take, dude. Also, this is not a gyno. Like, this is literally like a fucking physical therapist type doctor. I don't know how to. I mean, he's a doctor. He's a physician, not a physical therapist. He's a physician.
on their side?
on their side.
Yeah.
Yeah, you can do it on the side too. I mean, like I show them in all the different directions, but it's rarely on the side. It's more, if I'm doing something on the side, that's more for the SI joint. Generally, with the sideline, that's the lift and shift and the coccyx. You know, if there's a coccygynia, problem, then sideline, can be treated sideline.
Okay. All right, but you wouldn't, like if somewhere on the side, you wouldn't be doing the same.
There'd be an alteration. There'd be a variation. You got to adapt, just like standing. You know what I mean? Like, so you change it because of the three-dimensional.
It's very unsettling that a man wants to see vaginas all day. What? Bro, you know these guys are doctors, right? What is going on in my fucking chat, dude? Like that doctor is not looking at your vagina as like an object of desire, okay? He's looking at it like, well, not this doctor. We're not talking about this motherfucker. This guy's a fucking demon. But like a normal gynecologist or any doctor in general is not looking at your vagina like, oh my God, this is so appetizing. They're looking at it like, I'm a fucking doctor and this is something I need to fucking treat. Like, what the fuck?
Forces is depending upon what position they're in, it's going to have a different effect. So normally you try it one way, and one way doesn't work, then you try to seed it, you know what I mean, because of the way that you can affect. And I try and teach them, if it works, I've taught a lot of patients how to do it themselves. Okay. You know what I mean, like self-treatment, like, okay, I told them it's like giving themselves a hand wedgie, it's like reach and pull, like you're picking a wedgie, you grab, and then you pull off to the side, or you pull front, or, one of those three main vector forces is.
Okay. Would this ever involve like digital anal penetration?
Only if we're doing a coccyx,
Right.
problem. You know what I mean? So if there's a fractured coccyx or a coccyx disorder
What
too.
the fuck?
Possibly the most incriminating thing that NASA has said so far. He has now stated that reasons for inserting his hand inside of his patients, in the way that Detective Muntford has just described, would only be called for when treating things such as a fractured coccyx, more commonly referred to as the tailbone. This makes it much more difficult to present his actions as valid medical treatment when it comes to any woman who accuses him of touching them in this way, when they had no such condition.
So that you can come perianal because it comes up, when you have the pelvic floor attachments, but you can come to the pubic symphysis and
Thank
also
you,
close
Wine
to
Mom,
the
for the
coccyx.
5 gift sub.
So it's your lift, I call it the lift and shift, when you're doing that, so that's a very common to do one side or the other, and that's the straightforward. So like if you're here, here, or here, there's 3 different vectors, and that would be the straight vector. Like if I'm doing ribs a lot, then I would be going straight.
Okay. All right. Well, the reason I'm asking is that we did have another complaint.
Really?
Yeah. And it's a patient from a while ago.
Okay.
And she does describe some things that sound to me like they're out of the norm
Okay.
from your typical treatment.
Okay.
This would have been in,
Wow. Okay.
and she was receiving some of that type of treatment, but
Okay.
then there were also some other ways that she was touched that should
Okay.
be on the treatment.
Okay.
So that's why I'm asking about anal penetration.
Only if there'd been coccyx, and I would have, and it would have been, because you can push hard. There's a lot of room down there, but I wouldn't have gone intra-rectal. You know what I mean? Like unless I was purposefully.
Okay, he is nowhere near as confident this time around when he's like explaining his procedures as he was last time. Possibly because it's so close in proximity to the other gymnast like rape case. Do you see what I'm saying? Like the other like USA the USA team like gymnast team like rape case happened, like probably is on his mind. Doesn't have his PowerPoint, doesn't have his laptop. He is like literally, he's just like, I don't know, throwing some shit around. He seems spooked, which is good.
Treating the coccyx itself.
Okay.
You know what I mean?
What would you use to do that? Like what digit or what part of your hand would you use?
Well, normally I'm using my thumbs, as I'm coming up this way. You know what I mean? Then if I actually have to fix a coccyx, then I'm going to be using my finger inside and my thumb on the outside.
Also because the detective is not like asking him questions like, hey, what's up? Like, you want to get some ice cream later?
Outside.
Okay.
To
Do you wear
manipulate
gloves
the
when you do
coccyx.
this?
If I'm going to go intra, yes. You know what I mean? So.
I try. Dude, this is like the 7 millionth vibe check failure, okay? It's done.
This was a long time
Everything
ago, so I don't
beyond
know
this is
how
just
many
overtime.
Patients that you remember from back
Right.
then. This is a little bit of a personal question, so
Yeah.
I'll just be totally honest.
Yeah.
You have these young girls and they're
Right.
athletes.
Right, but they're usually with their parents. They're usually with
Yeah.
their parents, So that's why I explain a lot. you know what I
They're
mean?
athletes. They have
Right.
lovely figures.
Right,
They're very
right.
cute girls.
Right.
Do you ever get aroused during these exams?
Do I get aroused during the exam?
Yeah, like do you ever get an erection
Well,
or,
obviously you don't, you know what I mean? So
is there a reason that you would during an exam?
I shouldn't be getting an erection during an exam.
Right.
Statement analysis is a rather contentious area of study within forensics. There are investigators who have based their entire careers around the discipline and naturally swear by its reliability. Others contend that statement analysis theories are far too subjective to be relied upon. As is often the case with what we'll call soft sciences, the best way to look at it is as a sort of supplementary form of evidence. It's not something you should base an entire case on, but it is worth noting when some fundamental tells posited by statement analysis consistently come up. One sign of deception in statement analysis is what's referred to as distancing, and NASA just demonstrated 2 clear examples in a row. When asked if he ever gets erections during an exam, he first states, obviously you don't. This wording acknowledges that it would not be a proper response for an osteotherapist to have, but does not take on any of the personal ownership of a direct denial. He then follows it up with a statement that does begin with the first person pronoun I.
Listen. I don't know how the fuck, the moment he doesn't say like, no, of course not, I'm a fucking doctor. It's like, that's it. That's over, dude. What the fuck? Like, are you fucking kidding me, dude? What technique is this? I don't even fucking know, dude. I don't know what the fuck's going on at this point, dude.
But then uses the theoretical shouldn't, as opposed to the more assertive I don't get erections during exams. A core theory of statement analysis is that lying is actually instinctively much more difficult than we might think. If you wanted to get away with something, and you know in theory that a straightforward, firm denial is an honesty indicator, then you might think that it would be easy enough to simply execute the program and go through the motions of making those statements.
It's such a fucking simple question that like most normal people, no matter what, would just be like, what the fuck? No. Like,
but according to some, effective lying is no walk in the park, even if you know what you're supposed to do. Most people will experience a very discomforting sense of cognitive dissonance in verbalizing that which they know to be untrue. And so to ease that stress, they will subconsciously adopt wording that, while still feeling like a denial, technically keeps them within the parameters of the truth.
Well, this is why I'm talking to you about this, because this young girl and her mother both observed this on more than one occasion during treatment.
That it would get aroused during an exam.
Visibly an erect penis. Not exposed, but through your clothes.
I can't explain that, because that should, when I'm working, I'm working. You know what I mean? So I don't...
Well, you can understand why this would be
Well, yeah.
a concern.
what the fuck? What the fuck? What the fucking fuck, dude? No, 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 no. Oh my god.
Yeah.
Captions were wrong, right? What did she say? I have to hear that. I didn't understand.
I don't...
Well, you
That should, when I'm working, I'm working. You know what I mean? So I don't...
Well, you can understand why this would be
Well, yeah.
a concern.
Yeah.
You know, that you didn't wear gloves.
Working.
Wait.
Penis. Not
That it would get aroused during an exam.
visibly an erect penis. Not
Oh my god, no, she didn't say red penis. Okay, the caption was wrong. She said one of the mothers said that they noticed that you had visibly an erect penis.
not exposed, but through your clothes.
I can't explain that, because that should, when I'm working, I'm working. You know what I mean? So I don't...
Well, you can understand why this would be
Well, yeah.
Oh my god. Oh my god. Dude. What the fuck? At this point, you're like, you should be angry. What is happening? You should literally be angry across the board. What the fuck, dude? How is he not even like trying to deny it? It blows my mind. Like, what happened? How do you get caught off guard like this? Oh my fucking lord, dude.
a concern.
Yeah.
You know, that you didn't wear gloves.
Right, okay. But I mean, but I was like doing her coccyx. Actually digitalized the coccyx, like for a coccyx treatment.
The words that she used were he anally penetrated me with his thumb.
No, see, that wouldn't have been, see, I would never do that for the coccyx. I would use if I'm going inside, I'm using this. If I'm penetrating, it's not penetrating, it's pushing off to the
So I
side.
penetrated her. Okay.
What's confusing me about is, why wasn't there anything said back when I was treating them if they
Nah, dude, you're going to jail, bro.
felt that uncomfortable? You know what I mean? It's like if I'm talking to the patient...
Okay, put yourself being a teenage girl.
Okay.
All right.
What makes the fact that NASA skated through his first interrogation all the more frustrating in hindsight is just how ineffective a denier he's shown to be as soon as any pressure is put on him. Watch that moment again and note how he stops pushing back the moment Detective Mumford interjects and immediately adopts a submissive posture and demeanor.
Why wasn't there anything said back when I was treating them if they felt that uncomfortable? You know what I mean? It's like if I'm talking to the patient...
Okay, put yourself being a teenage girl.
Okay.
All right.
Okay.
Most people that are sexually assaulted are very uncomfortable. They don't know what to say.
Okay. But my fingers are up here. My thumbs are at the coccyx.
Well, that's not how she's describing it. Now, your fingers are vaginally penetrating her.
What?
And then your thumb
Uh-huh.
anally penetrated her.
No.
So I don't see where that falls in line with that technique.
Right, and I don't see how that would be accurate.
More than once, on more than one treatment.
I'm just working the floor, you know what I mean? But I would not be, how would I be putting my thumb and fingers, you know, like that? That would not be correct. You know what I mean? I am.
This is called the how would I be doing X if I was doing Y technique? Dude, he is, oh my God, dude. It's like a fucking deck of cards, dude. All she had to do was just blow on it a little bit. He is falling apart, dude.
Now, if there's some type of treatment where she's on her side, would you have any reason to touch her breast?
If I'm treating ribs, so if I'm treating ribs, that must have been, like I said, I would have been pushing and touching ribs, okay?
How would
And
you
that's-
touch her breast to do the ribs? I mean,
You
demonstrate
move-
on yourself.
Right, you're moving the tissue out of the way. You're moving the tissue out of the way to try and get down between the breast and the rib. Okay, so you're lifting and shifting again because you're moving the tissue out of the way. So if I'm moving tissue out of the way, I got to get down to where where I'm making contact, you know, with the rib. Okay, so you try and move and adjust. Okay, or the same thing here. If I'm on the head coming down, you're pushing down, or if you're off to the side, you're pushing off to the side. But you're you know, there's ribs that are underneath that area, so you're trying to slide through and across.
Okay, that makes sense.
Right.
But this girl saw you 5 times, and all 5 times there was something that, with her knowledge of what that treatment was, because she had some knowledge of it, went beyond that. The touching of her, the digital penetration of her anus, touching of her boob, and she could visibly see at that time that you had an erection, that you were aroused. Okay, she describes your demeanor, your behavior, your physical reactions, and being able to see an erection. Okay.
Okay, what I'm trying to do is release tissue and work through them, but I'm not trying to get my jollies out of this. Okay.
So explain to me, like, when you're doing an exam, is it physically taxing on you?
Yes. Oh yeah. Any medicine is physically taxing. Yes.
He saw that as an out, dude. Look how comfortable he gets. Oh my God, I'm turning into JCS. Pausing here. What you're recognizing here is Larry Nassar getting physically comfortable with this interrogator. For a brief moment, he stops his squirming as he believes the interrogator is on his side.
You know what I mean? There is no question about that. You know what I mean? Because you're moving body parts and you're pushing and you're really, and for me it's a lot of cerebral where I'm trying to visualize where the fascia is going, you know, and pushing and moving. Okay? You know, I'm trying to explain things while I'm doing things. You know, are you okay? Does that make it feel better? You know, like when I push them, like, does that feel better? Is that helping? You know what I mean? Am I pushing too hard? I'm constantly discussing that with them. You know what I mean? Like, does it help?
What would you say prior to doing this treatment?
What would I say prior to doing the treatment?
This is a very key point as to why Larry Nassar...
Wait, what did you say? What would you say prior to doing this treatment? Oh, dude. Like anything like this with an adult, with a patient that's an adult, any of the treatments that he's referencing, some of them are legit, some of them are not, requires like multiple instances of consent. Okay? The fact that they are also minors probably requires both the consent and informed consent of the child and also the guardian as well. And like the direct supervision, I assume. So there's no fucking shot that, he did the proper shit.
Doing the treatment.
This is a very key point as to why Larry Nassar is a serial molester as opposed to a misunderstood physician. Nassar is a practitioner of a type of alternative medicine known as myofascial release. The practice is, according to myofascialrelease.com, a hands-on technique that involves applying gentle
My man did his research at myofascialrelease.com.
sustained pressure into the myofascial connective tissue restrictions to eliminate pain and restore motion. It's purported to be effective in combating pain in all sorts of areas of the body, including the pelvis. And there are in fact certain types of pain where a practitioner of myofascial, or another school of physical therapy, might find cause to insert their hands inside of a patient as part of their treatment. Whether or not these types of treatments are actually legitimate in terms of having tangible medical benefits is a matter of some dispute. Internal pelvic floor therapy and
Banned? Are you fucking stupid? You don't get banned for that, you dumbasses. That's literally straight up like a fucking plastic, what do you call it? Reconstruction. Also, that's still strange to just fucking drop that in. Like, oh my God. It doesn't get more educational than literally that.
myofascial release more broadly fall into a similar category of medicine as chiropractic. Its benefits have yet to be substantiated by controlled clinical studies, but at the same time, a seemingly significant number of people passionately extol its virtues. Regardless of whether these practices actually help anything, or merely trigger a placebo effect, the main takeaway for the NASA case is that some of the physical acts he was undertaking could be performed ethically in certain contexts. The factors that make the difference between ethical and unethical in this situation are not at all complicated. Because of the intimate nature of this sort of therapy, a practitioner who plans on implementing internal maneuvers will always make sure their patient is aware of those plans and consents well in advance. NASA describes essentially checking in with his patients as he goes.
I like that even in the fucking, even in the educational like plastic mold for medical students, the fucking dude was wearing a glove. Just remember that.
Which is clearly not a high enough standard for something so invasive. And in case it doesn't go without saying, gloves are absolutely always a must, without exception.
You're at a doctor, someone that you trust, and all of a sudden, his fingers are essentially in your vagina.
What?
And with no explanation.
I would have explained it. I don't understand.
You'd be like, let me put it in your ass. See how you like it. You know? Actually, just kidding. I'm not even going to ask you for consent because you didn't either. Get fucking unbuckle your pants right now. Let me shove a couple in there. See how it goes for you.
I understand why she said I didn't explain it, because I always explain, okay, now you're going to
But
feel
you
like
didn't
pressure.
explain it 2 years ago.
Yes, I did. Well.
Did you ever ask him if it feels good?
Feel better or worse? You know what I mean? Does that feel better? You know what I mean? Are you doing okay? It's always better, you know, because I'm trying to see, okay, do I need, remember I said about the different adjustments, because do I need to go this way, or that way? It's based upon how they're responding and how I'm sensing the release, because I can sense the release, but I can't sense their pain. You know what I mean? And are you okay? You know what I mean? That's the thing that's very irritating to me, you know, is that if I'm asking the patient, you know, for feedback when I'm doing it, that's how I always feel like I'm okay, because I'm like, are you okay? Are you okay? You know, like you're talking real time, you know, with them. Okay, am I pushing too hard? Is this hurting? You know, like this, because you know, you don't want to push too hard to hurt them. You know what I mean? So, you know, does that feel better? Feel worse? You know what I mean? And then they respond. You know what I mean? I hope, you know what I mean? So, but that's what is frustrating to me, is trying to get an understanding of why there was that lack of communication. You know what I mean? But when you're talking to them in real time, you know what I mean? Like,
here's a word that hasn't been mentioned so far: consent. She asked, do you ask for consent before this procedure, or what do you ask them? He completely moved beyond that and was like, oh, you know, I just like ask him questions like, hey, does this feel good? Does this feel good? Throughout the entire process. It's so fucking creepy.
Like I'm asking their feedback.
But in a situation where you weren't talking and they didn't know what you were going to do to them, because
how many women do this treatment? Not women, girls, very young girls, as young as 6, over the course of like 20 years, and his number is in the hundreds.
No prior explanation. I mean, would a girl that young speak up?
Oh yeah, I forgot. He also, at this point, is like 5 minutes into describing his process, and 5 minutes ago, this lady investigator asked him if he had a fucking erection, and he still hasn't denied it. It's been 5 minutes since the investigator asked him if he had a fucking erection, And he still hasn't denied it, dude. I feel like this is the first point that you should address as a doctor if you are, if this is a medical procedure that you're engaging in.
When you're trying,
If she's
I'm
wondering
trying.
if she's not feeling okay, but she thinks it should be okay, and thinking about it later, then she realizes that it was not okay with her. I mean, there's lots of reasons why people do stuff.
I can see that.
Just to clarify, you're saying that during these treatments where you're dealing with young to old teenage girls who are very physically fit, very attractive,
Right.
that you don't get aroused when you're touching. I mean, you're essentially touching their genitalia,
Right,
touching
right,
their breasts. and sort of-
Okay, the investigator here isn't saying that because she thinks it. Before you freak the fuck out, chat. She's literally doing that because she wants him to admit to it, okay? Just remember, the investigator does not legitimately believe this. Okay? I just want you to understand. She's baiting him into being like, yeah. Luring him in with a false sense of security. To be like, oh, these feelings that I have in the heat of the moment, these feelings that I have are normal. Yeah. That's all that she's doing.
I'm not purposely trying to get arousal from doing any treatment.
Oh my
I mean,
God.
come on. You know what I mean?
Oh
I'm
my
not
God. Oh my God. And it's working because he is the dumbest person on the planet. That is fucking insane. How do you continue after this? Oh my God. Oh, Jesus Christ, dude. That's wild. Wild. He just said, I'm not purposely trying to get arousal. Like, as in he is getting aroused, but like not on purpose. What the fuck? That's wild. That's,
trying to gain some type of sexual gratification out of doing that. That's not what I'm doing. Okay, if there was arousal, it's. I mean, like it would be because of whatever. I don't know, but I'm not trying to.
I don't know.
Well,
That small moment.
I mean, he's literally like, oh, come on. Who amongst us doesn't get aroused at that? What the fuck, dude? That is like, there needs to be there needs to be something different than just saying that's a self-report. I feel like that's a self-thesis. He basically just did a self-dissertation. That's
was a very
really
good
bad
example of artfully keeping the pressure on. Detective Mumford does not badger her subject, but when she does interject, it's often with a question that serves to keep Nasser in an area he's uncomfortable with. It's clear that he's particularly uneasy with the subject of getting an erection while treating a patient, and when he starts appearing to entertain a hypothetical situation where that could happen, before drifting off with a generic whatever, Mumford makes a point of not accepting that non-example, extending the time he will need to speak on a topic he clearly wants to get away from.
I don't know.
When you're a guy, sometimes you get an erection. You know what I mean? But I don't. That's
You
what I'm
get
saying.
an
It's
erection
like,
when you're aroused.
but you know what I mean. Like I'm just saying that I'm not trying to. How do you say this? And if I had an erection, I understand why I would have an erection from doing the treatment. You know what I mean? From what I'm doing. Okay.
Mm-hmm.
And that's rather embarrassing.
Bro, this is literally like, okay, a normal human being in this situation just says, no, what am I, some type of fucking sex pest? Of course not. These are fucking kids, okay? I don't know why this dude is like trying to describe like biology 101 or, I don't know, retell the birds and the bees conversation. Like, to have the birds and the bees conversation with this fucking investigator. Like, just say no, dude. What the fuck?
You know what I mean? It would be rather embarrassing, okay? I mean, to have that happen, okay? So it's just like, that's not appropriate, okay? And that is, if I'm asking a patient, does this hurt? Or is it helping? You know what I mean? And they don't tell me the truth. How do I know then that I'm hurting them?
Mm-hmm.
that's the whole protective mechanism, so that I'm not harming someone, you know, so that there's real-time feedback.
Right.
Okay.
I understand what you're saying about the feedback, but I think there's a difference between like physically hurting someone and then them feeling touched inappropriately.
Right, but that.
And I think that's a different scenario of a comfort level to give feedback.
But that's hurting.
Does he think he's doing well? No, I don't think he thinks he's doing well, dude.
I mean, but that's hurting. I mean, like, if you're doing something inappropriate, that's hurting. That's not helping. You know what I mean?
Well, hurting mentally. But it may not be causing them physical pain to give you physical pain feedback.
Yeah, I mean, but there's a comfort level. You know, if you're doing something.
The fucking frame has been shattered, dude. He was so comfy. He was so fucking comfortable describing his position to the first investigator. It's over. This guy has like fallen apart completely. There's just no. I mean, he just knows this is indefensible.
And you're asking them.
Have you ever had someone do something that made you feel uncomfortable and you doubted saying anything?
I think you need to replace the batteries in your fire alarm. I don't have a fire alarm that is beeping right now. I think you needed to replace the batteries in your house, dude. Wait, never mind. I heard it. I just heard it. Yeah, no. That shouldn't have happened so quickly right after. Yeah, no, that literally happened. Okay, never mind. What the fuck? I'm sorry. But I'm not sorry for this ad break that I'm going to run right now because it's top of the hour. Every hour it's time for a 60-second ad break. Oh my God! How does he keep doing it? Oh, fucking got him, dude. Top of the hour, every hour, boys. Haha. If you'd like to no longer see the ads, you can subscribe. You can do it for free with a Twitch Prime, or you can do it for $5, the regular subscription. Or you use the ad block or VPN. But here's the ad now. Fuck, dude. That was so good. That was so fucking good, dude. I'm on fire today. I'm on fucking fire today, actually. Like, I'm actually... Oh, fuck, that was good. This is why people say you hate chat. Listen, motherfucker. I love this community, okay? I like to try to turn things into fun shit, all right? I could just be fucking auto running ads and you just get ads without recognizing that an ad is coming. Boom, in the middle of content. I'd rather not do that. So stop bitching.
The point Detective Munford is bringing up here is a cornerstone strategy of what are referred to in some circles as pillar of the community offenders. The considerable majority of child sex abusers do not fall into the stereotypical stranger danger profile. A child is far more likely to suffer abuse at the hands of an acquaintance offender, whether that be a direct family member or someone who ingratiates themselves with the child's family to gain access to them under circumstances which don't raise suspicion. Some offenders...
Okay, what the fuck is this, bro? It's the reverse Hitler. My man really went and said, I want to get the opposite of the Hitler stash. Which is when you the only thing you cut out is like where the Hitler stash is. What the fuck is this, bro? What is that? He wanted to make it seem like he's got boogers coming out of his nose. We're not going to talk about his eyebrows? I mean, he's old. Old people, like, their eyebrows grow to that degree if they don't take care of it, you know? It looks like he had a mustache, but he blew